Heart failure is one of those conditions that most people think they'll see coming, imagining dramatic chest pain or sudden collapse. But the truth is, it often begins quietly, with small everyday symptoms that can be so subtle you dismiss them without a second thought. And that's what makes it dangerous, because the earlier you catch the signs, the more time you have to protect your heart and your life. Imagine your heart as a tireless pump that works every second of every day to move oxygen-rich blood to every cell, muscle, and organ in your body. When it starts to weaken, even slightly, your entire system feels the impact. But instead of shutting down immediately, your body sends out signals. Signals that many people confuse for aging, stress, or minor health annoyances. Today, we're going to uncover 15 early signs of heart failure that people ignore daily, why they happen, and what you should do if you notice them, because knowing them could save your life. The first sign is shortness of breath during activities that used to feel easy. Walking a short flight of stairs, carrying groceries, or even making your bed. When your heart can't pump efficiently, your muscles and organs receive less oxygen, so you end up breathing harder to compensate. And this can also show up when you're lying flat in bed or wake up at night gasping for air. The second sign is swelling in your feet, ankles, or legs, something many blame on standing too long, aging, or hot weather. But in heart failure, this swelling, known as edema, happens because blood returning from your lower body to your heart backs up due to weak pumping, causing fluid to leak into surrounding tissues. If pressing a finger into the swollen skin leaves a dent that takes time to fade, that's called pitting edema, and it's a classic warning signal. The third sign is unexplained fatigue or weakness, a deep exhaustion that doesn't go away even with rest. This happens because your heart, struggling to keep up, prioritizes blood flow to vital organs like your brain and lungs, leaving your muscles short on oxygen and energy so that even light chores feel draining. The fourth sign is a rapid or irregular heartbeat, where you might feel your heart racing, fluttering, or skipping beats without any obvious cause. This is your heart's attempt to make up for lost pumping power by beating faster, but over time, it only adds strain. The fifth sign is a persistent cough or wheezing that isn't linked to a cold or allergies. In heart failure, fluid can back up into the lungs, causing pulmonary congestion, and the cough often worsens when lying down. If the mucus is pink and frothy, that's a serious emergency sign that requires immediate care. The sixth sign is sudden weight gain, not from fat, but from fluid retention. Gaining 2 to 3 pounds in a single day or more than 5 in a week without changes in diet should raise alarms. The seventh sign is a loss of appetite or feeling full quickly, because when your heart isn't pumping enough blood to your digestive system, it slows digestion, causing bloating and reduced hunger, and some people even feel nauseous. The eighth sign is confusion, memory problems, or trouble concentrating. Your brain needs steady oxygen and nutrients, and when the heart can't deliver them efficiently, mental sharpness fades and you might feel foggy without understanding why. The ninth sign is increased nighttime urination. During the day, fluid may pool in your legs due to gravity, but when you lie down, it shifts back into your bloodstream, and your kidneys work overtime to remove it, sending you to the bathroom more often at night. The 10th sign is swelling in the abdomen, called ascites, where fluid buildup causes bloating, discomfort, and even shortness of breath. The 11th sign is dizziness or fainting, which occurs because a weak heart may not be able to maintain stable blood pressure, especially when you stand up quickly. While dehydration or low blood sugar can cause similar episodes, recurring dizziness paired with other symptoms is concerning. The 12th sign is bluish lips, fingertips, or toes, a sign of poor circulation and low oxygen in the blood. This discoloration can be subtle at first, but is a clear red flag. The 13th sign is chest discomfort or tightness, which in heart failure tends to be milder but persistent, sometimes mistaken for indigestion or muscle strain. It may not be as intense as a heart attack, but still signals reduced oxygen delivery to heart tissue. The 14th sign is difficulty sleeping flat. If you find yourself propping up pillows or even sleeping in a chair to breathe comfortably, that's your body telling you fluid is pooling in your lungs when you lie down. The 15th and final sign is reduced exercise tolerance. If you used to walk a mile easily but now struggle halfway, it's not just getting older. It could be that your heart's pumping ability has dropped. What makes these signs tricky is that they don't all happen at once, and many can be mistaken for other conditions. So the key is to look for patterns and combinations. If you notice 2 or more of these symptoms repeatedly, don't ignore them. Tracking when they happen, how long they last, and what triggers them can give your doctor critical clues. And here's why it's urgent. Heart failure doesn't mean your heart has stopped, but it does mean it's working harder than it should. And over time, that extra strain can cause permanent damage. The good news is, if you catch it early, there's a lot you can do to slow or even reverse the progression. First, commit to regular checkups and ask for heart-specific tests like an echocardiogram, an ECG, and blood work to detect strain or damage. Second, make heart-friendly lifestyle changes. Cut back on salt to reduce fluid retention. Focus on fresh whole foods instead of processed ones. And keep your body active with gentle but regular exercise like walking or swimming. Third, keep an eye on your daily weight and swelling so you can spot fluid buildup early. A small change in the morning scale reading could be your first warning before symptoms worsen. Fourth, manage stress with breathing exercises, meditation, or hobbies you enjoy, because stress hormones can raise blood pressure and add to the heart's workload. And fifth, avoid smoking and limit alcohol. Both can damage heart muscle and weaken circulation. By knowing these 15 signs and taking them seriously, you give yourself the best chance at catching heart failure early, when treatment is most effective. In Part 2, we'll break down exactly what's happening in your body during each of these symptoms, how to tell if they're really from your heart or something else, and the simple but powerful daily habits that can keep your heart strong for years to come. So stay with me, because this information could literally add years to your life. The first thing you must understand is that heart failure doesn't mean your heart has stopped working. It means the heart muscle has become too weak or too stiff to pump blood efficiently, and when that happens, every system in your body starts to feel the effects. Take shortness of breath, for example. In early heart failure, the left side of your heart struggles to push blood forward, causing it to back up into the pulmonary veins that return blood from your lungs to your heart. This increases pressure in those veins and forces fluid into the tiny air sacs of the lungs, making it harder for oxygen to pass into your blood. The result is a sensation like trying to breathe through a wet sponge, which explains why lying flat can make it worse. The fluid spreads more evenly through the lungs, making breathing even more difficult. In contrast, shortness of breath from asthma or a lung infection often comes with wheezing, chest tightness, or fever, and tends to improve with inhalers or antibiotics, while heart-related breathlessness usually improves when you sit up or stand. Then there's swelling in your feet, ankles, or legs. When the right side of the heart can't keep up, blood returning from the body backs up in the veins, creating pressure that pushes fluid into surrounding tissues, while standing all day or hot weather can cause temporary swelling. Heart-related edema often gets worse as the day goes on and leaves a lasting dent when you press the skin, and it may be accompanied by other symptoms like weight gain or shortness of breath. Fatigue in heart failure is more than just feeling tired after a long day. It's a deep, lingering exhaustion that doesn't go away even with rest, because your heart prioritizes blood flow to essential organs like the brain and lungs, leaving your muscles undersupplied with oxygen and nutrients, so even small activities feel like a workout. This is why people often start avoiding physical activity without realizing their heart is the real issue. A rapid or irregular heartbeat, sometimes felt as palpitations, is your heart's attempt to make up for reduced pumping power by beating faster or irregularly to try to deliver more oxygen. But over time, this extra strain can damage the heart further. Occasional skipped beats can happen in healthy people too, But if it's persistent or paired with dizziness, fatigue, or breathlessness, it's a sign to get checked. That persistent cough or wheezing in heart failure is due to fluid in the lungs. And while a cold or bronchitis might cause a cough for a week or two, a heart-related cough can go on for weeks and tends to get worse at night. The presence of pink, frothy mucus is a classic red flag that fluid mixed with a little blood is leaking into the airways. Sudden weight gain from fluid retention happens because your kidneys, reacting to lower blood flow, hold on to sodium and water to try to increase blood volume. But instead, this extra fluid overloads your circulation and leaks into tissues, causing swelling and extra pounds on the scale seemingly overnight. Loss of appetite or feeling full quickly happens because reduced blood flow slows down digestion and can even cause mild swelling in the liver and intestines, creating bloating and discomfort. Unlike typical digestive issues, this loss of appetite may come with swelling or breathlessness. Confusion or memory problems in heart failure occur when the brain gets less oxygen and nutrients, which can feel like mental fog, forgetfulness, or trouble focusing. This can be mistaken for age-related decline. But, in heart failure, treating the underlying cause often improves mental clarity. So, increased nighttime urination happens because, when you lie down, fluid that pooled in your legs during the day re-enters the bloodstream and is filtered out by the kidneys. Now, while this can also happen with diabetes or prostate issues, if it shows up together with swelling or breathlessness, it's more likely linked to your heart. Abdominal swelling, or what we call ascites, is basically fluid building up in the abdominal cavity due to increased pressure in the veins around the liver. And, while this can occur from liver disease, in heart failure it often appears along with swelling in the legs and, fatigue, dizziness, or fainting. Well, that comes from reduced blood flow to the brain and might be triggered by standing up quickly. And while dehydration can do this too, in heart failure, it often happens even when you're well hydrated. Bluish lips, fingers, or toes show up because your tissues aren't getting enough oxygen-rich blood. This kind of discoloration can be pretty subtle at first, but it's a serious sign of poor circulation. Chest discomfort in heart failure may not be as intense as a heart attack, but it can still feel like pressure, heaviness, or tightness. And if it's consistent, especially when you're active, it's definitely a warning sign. Difficulty sleeping flat comes from fluid moving into the lungs when you lie down, making you need to use several pillows or even sleep in a chair just to breathe easily. Reduced exercise tolerance is often the first thing people notice they can't do as much as they used to without stopping to catch their breath and, honestly, it's a sign the heart's pumping ability has declined. Now the important part is what to do next, because knowing these signs is only useful if you act on them. The first step is awareness. Start tracking your symptoms in a notebook or on your phone, noting when they occur, what you were doing, and how severe they felt. Patterns are what help doctors make accurate diagnoses. The second step is getting a proper medical evaluation. Don't just assume these signs are from age or stress. Ask for heart-specific tests like an echocardiogram to see your heart's structure and pumping ability, an ECG to detect rhythm issues, and blood tests like BNP levels that can indicate heart strain. The third step is to make lifestyle adjustments that take the pressure off your heart and improve circulation. Reducing sodium intake is critical because salt makes your body hold onto water, which increases fluid buildup. So, avoiding processed foods, canned soups, and fast food while focusing on fresh vegetables, fruits, lean protein, and whole grains can make a huge difference. Managing your fluid intake based on your doctor's guidance can also help prevent overload. Avoid smoking and limit alcohol. Both directly damage heart muscle and increase the risk of rhythm problems. Incorporating gentle physical activity like walking, swimming, or cycling can strengthen your heart over time, but always start slowly and build up gradually to avoid overstraining. Stress management is another overlooked factor. Chronic stress raises blood pressure and increases inflammation, both of which can worsen heart failure. Activities like deep breathing meditation, light stretching, or simply spending time outdoors can help lower stress hormones. Maintaining a healthy weight reduces the heart's workload, and controlling blood sugar and blood pressure keeps arteries healthy and open for better blood flow. Another key habit is weighing yourself daily at the same time each morning, ideally after using the bathroom and before eating, so you can spot sudden weight gains from fluid retention. Catching this early can prevent dangerous flare-ups. Good sleep is also vital, because poor sleep quality or untreated sleep apnea can increase heart strain. If you snore loudly or wake feeling unrefreshed, a sleep study might be worth discussing with your doctor. Follow-up care is essential, because heart failure is a long-term condition that can be managed but not ignored. Regular checkups allow your healthcare provider to adjust medications, monitor your progress, and prevent complications. The bottom line is that heart failure rarely develops overnight. It gives you warnings, and the earlier you notice and respond to them, the better your chances of living a long, active life. Ignoring the signs can lead to severe fluid buildup, dangerous rhythm disturbances, and sudden hospitalization. But taking them seriously can keep you stable and independent for years. If you've recognized any of the symptoms we've talked about, even if they seem mild, the safest step is to get evaluated and start making changes today. You have the power to protect your heart with the choices you make daily. And small changes done consistently can lead to major improvements over time. So don't wait for a dramatic event to force you into action. Listen to your body now. If this video has helped you understand your heart better, make sure you like this video, subscribe to the channel, and share it with friends or family, because you never know whose life you might save simply by passing this information on. Every view, every share, every conversation about these signs can be the reason someone seeks help in time. And that could be the difference between years of health and a sudden emergency. Your heart is the engine that keeps you alive. Give it the attention it deserves starting today.